Hello again, everyone, and welcome to another Health Minute brought to you by UniCare. UniCare, one of our sponsors here at InsideLowell. I'm proud to bring you a Health Minute each and every month. We're going to bring in our guest, Dr. Carolyn Langer, the medical director at UniCare, in a quick moment. First, I want to thank all of you for joining us, and I want to thank our sponsors for helping to make this podcast, all of our InsideLowell podcasts, and all of InsideLowell, for that matter, possible. InsideLowell podcast brought to you in part by the Washington Savings Bank, serving the greater Lowell community for over 130 years. Make the switch now to Washington Savings Bank. Of course, UniCare, the sponsor of the Health Minute, offering a variety of plans for people insured under the GIC. At UniCare, your health is their top priority. Boston North Company Business Solutions to help restaurant and retail clients save money, make your business more profitable with Boston North. Mahoney Oil Company providing warmth and protection to families in Greater Lowell and Southern New Hampshire since 1925. Almost a century, folks. That's Mahoney Oil. Francis E. Preventure Insurance for auto, home, business, and life. Trust the insurance agency Greater Lowell has counted on for more than 40 years. Francis E. Preventure Insurance. GoPuff, a grocery store right at your fingertips. Use the code Lowell20 to receive $20 off your first order of $21 or more. Plus, you will get free delivery. Download the GoPuff app or visit gopuff.com today. And by the Massachusetts Pirates, bringing all the hard-hitting action and excitement of arena football to the Tsongas Center in Lowell. Get your tickets today by visiting masspiratsfootball.com. And with that, we turn our attention and bring in Dr. Carolyn Langer, medical director at UniCare. Hello again, Dr. Langer.
Hello, Teddy. Good morning.
It's great to see you again. You helped get us all through the holidays, Thanksgiving and Christmas and New Year's. And I swear I paid some attention. Hopefully our audience did as well to some of the things you mentioned there. So we've got a new topic to talk to folks about today. But before we do that, a little bit about your background. You've been with UniCare for 2.5 years now. What does a medical director do? What are your responsibilities at a place like UniCare?
Yeah, sure. So I provide clinical leadership to promote whole person health. So implementing clinical strategies and clinical initiatives to improve access to care, to provide high quality care. But when we talk about whole person health, we're not just talking about physical issues. We're also talking about emotional, behavioral health, really the whole person.
Yeah, people will pay attention, most people will, to the physical health, but it's those other components that go into whole health that people sometimes kind of don't focus on. And it's great that you come in here every month and do that for us as well. Why is it that we sometimes don't factor in all the other things that go, the emotional, the mental, even financial health, right? We don't factor these into realizing how much it affects our physical health, right?
Right, and absolutely. And these other issues can really sometimes be more impactful than our actual physical condition. So it's important to take care of yourself. And I know it's easier said than done with other responsibilities, job responsibilities, family responsibilities. But we have to remember to take care of the whole person and not just go to a doctor when we're feeling sick, but think about how we can stay healthy even when we're not at the doctor's office.
And that brings us to body image, body positive. It's a new year, so we're going to try to help people learn to love the body that they're in. First of all, what is body positive? What does that mean to those who are watching this?
Yeah, with a near constant stream of social media images from friends, from influencers, celebrities, and brands, it's easy for us to compare ourselves to an ideal of perfection and beauty. Body positive is a movement that promotes acceptance of all bodies, regardless of age, gender, skin tone, physical abilities, and really encourages a positive body image that's based on treating yourself and your body with respect and appreciation. Building body acceptance is really critical because having a negative body image can lead to some serious consequences, eating disorders, mental health conditions, performance enhancing substance use, and depression or suicide even.
Yeah, you mentioned social media, and to some degree, that's always existed, right? Whenever they did a diet soda commercial, right, there was always the skinny model in the bikini, or when they were selling men's shaving products, it was always somebody built like a Greek god as opposed to a Greek podcast host. But nowadays with social media, you can't.
By the way, you're still a Greek god to us.
Well, thank you. At least to some. There must have been a Greek god for overweight people, right? But social media just drives that home, like constantly, with Instagram. And you mentioned influencers. I mean, but, especially younger people, teenagers in those vulnerable years where the psyche is being formed, they really do get influenced by that. And that can do some long-term damage.
Absolutely. And that's why it's really important. If you find yourself with a poor self-image, it's time to change the negative self-talk and be thankful for everything that is right with your body. So, for example, practice gratitude. Be thankful for all your body does for you each and every day. Scrub your social media feed. If certain apps or people make you feel bad about yourself, remove or unfollow them. Surround yourself with positive trends. Surround yourself with positive people. They'll support and love you for who you are, not how you look. Give yourself encouragement. Post inspirational quotes on your mirror or repeat a positive saying each morning. There's so many other things you can do. Focus on yourself as a whole person. We were just talking about whole person health. Make a list of all the good things you do for family, friends, your workplace, your community. Shift your energy when you're feeling bad. Go for a walk with a friend, write in a journal, and practice mindfulness meditation.
It's funny you kind of mentioned, because most people generally do have a negative body image. Even some of the people I look at them like, oh my God, I wish I was as fit as he was. Or you look at a lady and say, wow, she's in great shape. But if you sometimes talk to them, they're checking a mirror constantly or looking on the phone, and the whole selfie thing, and now the cameras are everywhere. It really, again, it kind of drives it home. In terms of children, what are some mistakes that parents might make that unintentionally are kind of feeding into some of this pressure that their kids are facing?
Yeah, great question. Kids pick up a lot of cues from their parents and certainly from advertising and social media. Those play a very significant role, as you were just saying, in poor body image. So to help your children, it's always important to show them that you love and accept them for who they are. It's important to keep an eye on their social media feeds, though, and talk with them about what they see. Be especially aware of changes in eating or exercise habits in your children. Listen for negative comments about themselves, and be careful not to comment or focus on their or your own weight. Don't perseverate on that. Don't shame your children for eating certain foods. Don't over control their eating.
Yeah, so the food thing is really interesting, because you want your kids to eat healthy. We talked a little bit about that with trying to get healthy snacks over the holidays. At the same time, they're kids, and they're watching TV commercials, and it's pushing junky foods. They're seeing some of their friends in school that are doing the same thing. Yeah. So that's kind of a fine line you have to walk, right, between shaming them but also making sure they're eating healthy snacks at some point, right?
Absolutely.
Yeah. Are there any resources that are available that can help folks out?
Absolutely. So there are many resources available to help. Some include just talking with your doctor or therapist, who can help you discover what healthy means for you and how to maintain body positivity. There are some very specific resources. So, for example, the Body Positive website, that's at thebodypositive.org.
Easy enough to remember.
That's right. Mental Health America, MHAnational.org. And then National Eating Disorders Association, so nationaleatingdisorders.org. Some very useful resources.
And eating disorders is kind of the the worst case scenario that develops right out if somebody is growing up and developing a negative body image, right?
It is, and it's fairly prevalent in adolescents and young adults. So it's really important to be on the lookout for early signs and get these individuals referred early for medical help.
It's interesting that this whole conversation kind of spurred a memory of my wife has been away, so I've been in charge of getting the kids ready. And my daughter decided one day she wore a dress, and she came up and she said, "Daddy, do I look pretty in this dress?" And I'm like, "Yes." And then it came right around. I'm like, "Oh wait, but I need to kind of qualify that." And I said, "But you look beautiful all the time, Ruby. You look beautiful in your jeans, and you look beautiful when you're outside playing in the mud."
That's the perfect response.
So I think from what you just told us, I think I might have passed that test. But I got a hunch I'm going to fail a few more going along the way.
No, that's the perfect response. We want to enhance and bolster their self-esteem all the time. Not just when they're meeting this ideal we have of perfection.
But it is funny how, because she pays attention to her mother's meticulous when she gets ready, and she's doing it already at the age of 4. So I'm going to have to keep an eye on that one, aren't I?
No, kids definitely pick up on their parents' cues starting at a young age.
Yeah.
But that was the perfect response.
All right. Hopefully in this new year, you've learned to look at your body image in a new way, in a positive body.
Absolutely.
For that matter. Dr. Langer, thank you so much for joining us today.
Thank you very much. It's been great to be here with you today, Teddy.
Always great to have you here. And thank all of you for joining us as well. Thank you to UniCare for bringing you this Health Minute. We'll have another one for you in February. Till then, stay safe, everybody.